thank you for listening to the Trinity Health Freedom Expo 2020, and I know it's a virtual event. My name is Dr. Dave Simone. I have no financial interest in any products that I would mention, and I just want to make sure that everybody has health freedom in this world. My update this fine day that you're listening to this, whether it's live or after, is called Mercury Amalgam Update 2020. There's been some changes and the ball has been moved forward. I'm going to go ahead and remove my mask now because I'm in a safe room with nobody that I can contaminate, and the room has been disinfected. I happen to have it in my conference room at my residence. So here's what we have that's new for 2020. We are going to save women and children. The Trump administration's FDA has just recently ruled on the recent amalgam ruling. And the good news is that they've recognized that mercury amalgam has potential effects on the human body. One of the things that we have to show the FDA more, according to the ruling, will be the fact that there is not enough evidence to show that mercury coming off the filling as a constant vapor is causing any significant health issues. So it's mostly for what we call healthy people. So we have more freedom thanks to the FDA, but not quite the amount of freedom that we would like. It is still recommended not to remove mercury fillings if they are functioning and in place and don't have any cavities or fractures in the teeth, and they are considered or deemed as functional fillings. So that is a point of continued controversy, is whether a mercury filling is ever a safe material. And it is something that we need to continue convincing the FDA that there are issues with it. Some of the positive notes about mercury amalgam is that now the amalgam manufacturers have had to put in their directions a item to use a dental dam, not only during the placement, but also the removal of a mercury filling. So that's now part of the regular instructions of every mercury filling material that's out there. My technique of trying to safely remove mercury fillings is, of course, not to drill on the metal at all. It's been one of my long-standing positions on this, and is to simply take a minor, very small little dental burr on your drill and to trace and go around the mercury filling, trying not to touch it at all while wearing your protective garb, and the patient has the oxygen mask on, the dental dam on, and they're draped. And as far as taking any chelating materials, or you can take the clay or any zeolite or any of the products that you'd like to take before, during, and after, as far as mouthwashes or capsules that you'd like to help absorb. Charcoal seems to work as well too. And there's a myriad of ways to attempt to detox mercury out of the body, which I'm not discussing here. This is mostly an update as to your health freedom. And it is important because these days we have so much going on with COVID and with the response to COVID as to how strict we should be with our masks and social distancing. And it's interesting because everything that we should be doing is already written down in the Homeland Security Manual from almost 20 years ago that I was lucky enough to be given when I volunteered for Homeland Security back in 2002. And the response is basically a chapter this thick of: you need to socially distance, you need to quarantine each other, we need to not knowingly pass it to each other, we need to be safe when we gather in any public spaces, wear our masks, and be as healthy as we can. So how does this all tie into the Trinity Health Freedom Expo? That is what all of these speakers are discussing, is how do you, as a patient or as a consumer of healthcare services, how do you protect yourself as much as possible, be as healthy as possible, have as much choice as what to do? I happen to have a number of anecdotal case reports about people who have been ill before they started treatment and improved when they finished treatment. And some are extremely dramatic, and some people don't notice much change at all, because it depends on how many sources of mercury you have in your body, whether it's diet or from the air, from the land, sea, and air, like we've learned from the United Nations Environmental Program, from the Global Mercury Treaty called the Minamata Convention, which I also was very integral in working and helping to author the 8 sentences that are in the treaty that are agreed to. And that process has begun. But as anything, it's going to take a long time for everything to be phased out. Some countries did a complete phase out of material. Some countries did a phase down. And some countries are just going to struggle with stopping the use of mercury fillings. And even in the United States, I have a patient on Saturday that's coming in, 15 years old, who was given 3 mercury fillings and wasn't given the choice of having any other materials. And of course, that brings to the next subject of how materials and how safe are they? There's many types of composites. There's many types of porcelains. There are different types of cements to use to bond those in. There is no perfect dental material out there besides your natural tooth structure, which obviously can decay as well. So when we're looking at the entirety of this mercury amalgam issue, we've had many organizations, many efforts. I'm just a little pea in the pod of this entire gathering of scientists around the world who have expressed concerns about mercury fillings, expressed for years on what to do about them and how to safely get them out of your life. I happen to take it a little further, where I also don't want to contaminate the staff or the rest of the environment around the office, myself, the patient, and people downstream. Because one of the other great achievements is that somehow, some way, in 2017, I discussed amalgam separators at the UN meeting, and I was able to get the current EPA to rule on their final rule on the dental amalgam rule that almost every single office in America needs to have mercury separators placed in them so that all the debris that they're not capturing or drilling on when they accidentally touch the filling and creates that plume of mercury dust and debris and shards that come off and they go in the suction. Those had previously gone right through the whole office and out into the sewer system and then back into our drinking water supply for that circle of life of a toxic material, a bioaccumulative biotoxin. And of course, the toxicity levels that we've concerned ourselves with are only for one type of element, never in combination with lead or arsenic or aluminum. So there are so many factors to the mercury amalgam that still have to be addressed, but the ball has been moved forward so tremendously. Organizations like the Academy of Oral Medicine and Toxicology, the Holistic Dental Association, the IABDM, these are all organizations that have helped to educate the professionals and educate patients such as yourselves that are out there looking for information that can help you guide to the safest dental material, the best solution that you can have. Again, there are no non-toxic materials. There's just the least toxic materials. And so arguments have been made on both sides. Both have valid points. But my conclusion after all these years, I've had enough anecdotal case reports of people being improved after removing their mercury, whether it was from the immediate relief of the battery effect or some other reason other than just flooding your system with the elemental mercury, which then gets methylated by your bacteria into methyl mercury, which is nice because that's how you excrete it out of your hair. And all these processes I've spoken about over the years. This is my 4th time speaking for the Trinity Health Freedom Expo, and then originally in 2000 up until 2013 it was just the Health Expo. So adding in the Trinity School of Health as to the backbone of this entire meeting has been a joy. Last year, we actually had a facility and had a meeting where I got to speak in front of a crowd of people and then also enjoy other lecturers at the same time and the commiseration and everybody speaking about our topics, because elemental mercury from your dental amalgam is just one source. And of course, there are many other sources that have been discussed and to the point of significant controversy. So on the one hand, I know enough about amalgam fillings that they shouldn't be placed in children, in women of childbearing years, or women who are pregnant or are nursing. I mean, those should seem like very obvious, low-hanging fruit type of items that most people should know about. And my job over the last 25 years on a volunteer basis has been to educate the public. And this is what I'm doing here today. In fact, I'm so passionate about it that I've had patients say that you must continue this education, even though there's not much new, besides the fact that the United States government has decided that women and children and their health is more important than placing a mercury filling. So that is a significant movement of the ball forward. And I've worked, this is the fourth administration I've worked with to try to do this. We did it with the Clinton administration. It didn't seem to go too far. The Bush administration was pretty busy with the Gulf Wars. President Barack Obama was able to get the UNEP treaty started, and we were able to push that even further, along with Consumers for Dental Choice with Charlie Brown, for example. Worked with him for a number of years, and with his efforts to stop the placement of mercury fillings. And whereas my efforts have gone further in taking it in the safest removal and then the sequestration of the amalgam waste, and that recognized as part of the global mercury pollution problem. And if I would have been able to show that dental offices are greater than a 5% contributor to the entire global mercury waste that's on the market and the amount of pollution that we have out there, then dental facilities would be considered polluting facilities. So I think as a, let's say, a negotiation, that dental offices and the need to have mercury separators in them is a kind of compromise for the labeling of offices as polluting facilities. It's just the general recognition that every dentist should realize that, you know, this material has a toxicity to it. It has a legacy toxicity to it. And it's also this bioaccumulative material that if you're not careful with it, you can't undo once it's unleashed. It's the genie out of the bottle type of problem. So that is the basis of where we're at. But I also have some anecdotal case reports of cases that I've had where I've had this tremendous change in a patient's health, ranging from they've come in with neurological issues or diagnosed maybe with something like MS, and then through the process of removing the mercury filling safely and then going through their chelation and nutrition and recovery process, they've gotten a lot better. And in fact, one of my cases was one of those perfect identical twin cases where one twin had 7 mercury fillings over his lifetime. They're both currently aged 30. And the other twin somehow never had a filling at all. Even though they're perfectly identical twins, apparently one snacked more than the other on candies and snuck them or something. We never were able to figure out the exact reason why there was a difference in diagnosis of decay, let alone the type of treatment that was done. But if the FDA ruling that is currently in existing today, even though it doesn't say remove every mercury filling that's in every patient's mouth because it's constantly leaching mercury, which it does admit to in the ruling, this patient, this twin, when they first had their first neurological issue from that first mercury filling, likely would have fallen to the category that the dentist would not have placed any more mercury fillings into that patient's mouth because of today's current ruling, and likely would not have suffered over the years. As he states, I have an entire presentation, it's fairly thick, And this gentleman and his brother were nice enough to go through their entire medical and dental histories and correlate, this treatment, this side effect. And when it's added all up, I mean, it's literally, I've got a 50-page report here that's amazing. And this is the kind of report that needs to be published with the FDA. The patient is currently planning on making arrangements for publishing this document and also filing a complaint with the FDA of adverse reactions over a lifetime, starting at the age of 4. So there's a lot still going on with mercury amalgam in the fight and the struggle to eliminate its use completely, which is half the battle. And the other half of the battle is to give you the freedom to choose which materials you want in your mouth and have someone who can safely put them in. Why somebody would still choose a mercury filling may be motivated by the costs, even though we've shown studies saying that the costs are relatively the same, especially when you include the green accounting for what needs to be done for mercury fillings as their legacy issue, as I was discussing before. This toxicity that exists in the sludge of all the sewer lines, the drying fields of all the sewer treatment centers, because that sludged mercury either goes into the drying pit and then gets reused as fertilizer, which means then it gets spread amongst all your vegetables and fruits and reincorporated back into our mercury life cycle that way. Or it stays in the water, gets pumped out back into your lake or stream as clean water, and then suctioned back in that way while getting all the fish and wildlife at the same time. And that has nothing to do with the mercury from burning coal or the mercury that's excreted from your body that's not in a dental office. So for example, every day, if you have mercury fillings, you're leaching mercury into your body. Some of it's being excreted, some of it's being bioaccumulated. And so that wastewater is not getting treated because it's not particulate matter, it's at the elemental level. So there's a lot of mercury issues that still exist. But as I said, it is finally refreshing to see that the current administration's FDA has recognized that mercury fillings aren't just a controversial issue. It's a long-standing health issue that can have more significant effects on certain subsets and populations, those with pre-existing conditions, which has been a very popular topic lately. So of course, we all have pre-existing conditions, and in a year, probably half of us would have COVID as a pre-existing condition, because half of us have had it at that point, or a third of us have had it. And again, trying to maintain your health, here we are trying to maintain the healthiest bodies that we can possibly with the least amount of toxic material in them. And if there's something that's low-hanging fruit, and the easy fruit to pick, the simple things that we can do for ourselves, like some of us making food choices, unless you live in a food desert, or some of us making healthcare choices, unless you're limited by the limitations in your plan or the expenses of them. I unfortunately had some recent MRIs and diagnoses, and my deductible happens to be $8,000. 10 years ago, my deductible was $1,000, and my premium has more than doubled. So the answers to our health freedom include the costs and the access to care, the type of care that we're receiving, trying to eliminate any trauma to ourselves so that we don't need emergency care, trying to eliminate any bad habits to ourselves so that long-term chronic treatments aren't required. And so there's a number of factors. But the amalgam update is meant to show you that things can be moved forward and accomplished with persistence, lobbying techniques, doctors and patients involved in trying to educate our government bodies and manufacturers of materials and the industry as to what the needs of the true needs of the patient are and what the complications are. And like I said, the liability issue of the mercury filling. There were some previous court cases where people had adverse effects immediately after placement of mercury fillings. And so in order to kind of protect themselves, the manufacturers have said, okay, let's use the composite protocols of using a dental dam during the placement of a mercury filling, but also so that there's no liability for the removal, that you use a dental dam for that because it does protect from particulates going down into your lungs and into your stomach, or having pieces, you can better isolate the mouth from being drenched in little particulate matter from the mercury filling materials. So there are websites that you can go to. One of them is the Academy of Oral Medicine and Toxicology, the IAOMT.org, the IABDM, the HDA. These are all their websites for their holistic dental groups. And you can locate dentists that are capable of providing the safest care possible for the removal of mercury fillings. It is in the FDA ruling that I need to educate my patient as to the benefits and the disadvantages of keeping a mercury filling that's existing in the mouth or removing it, and all the pros and cons of both procedures. And I think that's actually wise to do, because there are no perfect procedures and there are no perfect materials. So depending on the patient and how sick you are, that's another point. How sick are you? Are you having direct neurological complications that can be directly tied to the placement of your mercury filling, such as I have in my twins case, where I have a twin who had absolutely nothing, and a twin who had obvious problems and was not, the course of treatment wasn't changed over their lifetime due to that, which in today's FDA ruling, that course of treatment would be changed immediately. So this is the kind of thing where now, how do I get half the dentists in the country who still think mercury fillings are great to put in to be more cautious with this toxic material? And that is where we're at today. Is the ball has been moved forward. Like I said, thank you to the current administration for understanding that mercury is an issue. It has addressed mercury in other portions of the health fields and the controversies there, and trying to get as much of the data possible. And my goal is to educate you, the patient, that you have a little more health freedom now, a little more. So what are you going to do with that? You're going to try to get more health freedom. We're going to try to control our costs. We're going to try to get doctors to be more involved in a more holistic approach to the human body. And that's where we're at today, is this myriad of ranging effects. And it's hard to describe, because I see a lot of different patients with a lot of ranging health problems that aren't just heavy metal toxicity related just to the one particular metal of mercury, just from their one source of their mercury amalgam filling material. And so trying to point your finger and say this is 100% cause of the problem is very challenging in these cases. It's not like, you know, how, for example, someone who gets a lung cancer but never smoked. And so you can't just point to the cigarettes and say, see, that was it. And so how you cleanse the body, how you choose to have the fillings put in. Like I said, on Saturday, I'm going to have a patient in the chair, 15 years old, just had 3 mercury fillings put in a year ago, and has all of a sudden severe acne everywhere. And that is one of the side effects that's listed even in Dr. Andrew Cutler's book from 25 years ago of amalgam illness and all the things that happen. And of course, some people ask, why do I do this, and have put in all this effort, and especially over the last decade, working as much as I could at the United Nations, doing the Global Mercury Treaty, going to Washington, D.C. a couple times, working with the different consumers groups and different holistic dental associations. And it's mostly because it is so rewarding to have a patient improve and look you in the eyes and say, thank you for recognizing what part of my problem was and fixing it. And so through these anecdotal case reports, like for example, someone who has twitching, and that's usually the battery effect of a row of mercury fillings in the mouth. And once you remove the battery, sometimes the twitching goes away. So a couple of times in my career, I've had patients report that. But these are all items that should be generally known, should be taught in dental school as part of curriculum. And I know at Trinity, they are more holistically minded and do speak of these items. There are other items in dentistry that have as much controversy as well. For example, if you've ever seen the movie from one of my great mentors, Dr. David Kennedy, and it's called Fluoridegate. He's also the doctor who did the smoking tooth video and has a number of different YouTube presentations and lectures and testimonies, and has spent his entire career trying to stop mercury and the placement of fluoride into water as a dentifrice, and working with Dr. Kennedy and always enjoying his speeches, working and listening with Dr. Boyd Haley, who has done so much on the advancement of understanding how mercury works in the body and its involvement with other metals, how it limits hemoglobin's oxygen transportation capabilities, how it affects neurons, how it precipitates with aluminum, and a number of different aspects, let alone the other forms of mercury and the more toxic forms of mercury, which are not naturally occurring. At least there's elemental mercury, and the human body is designed to deal with that on acute exposure levels. It's one of the great things that, you know, evolution and nature and creation and everybody who ever put us together and however we've come together, we have the ability to detox mercury naturally out of our bodies when exposed to it at acute levels. That is one of the most amazing parts of the human body. What we're not designed to do is deal with man-made pollution on a chronic, ongoing, long-term condition in a bioaccumulative system where it gets worse and the concentrations go up in your body. I was lucky enough to sit next to a researcher from MIT who was at the United Nations. This was about 5 years ago. And she was researching how a swamp 1,000 miles away from a coal burning power plant that was placing mercury into the air in an elemental state would come downwind and settle into a bog. And the bacteria in that swamp would methylate that mercury and turn it into the methylmercury, which is bioaccumulative in our aquatic life. And so I said, well, what if that mercury only traveled 1 millimeter as opposed to 1,000 kilometers and traveled from the filling in the mouth down under the gum tissue, where you could have bacteria methylate the mercury, and now you've just made methylmercury inside your own body. The advantage to making methylmercury is, of course, you can have the ability to excrete out of your hair the methylmercury. So usually when you get tested, you actually want to be showing methylmercury coming out of your hair, because if you're not, that means you're not excreting. And we've learned over the years that we have different genetic predispositions to excreting mercury, the APOE genetic strain. And whether you're a 1 or a 2 or a 3 and a 4, or you went to a 1, 1, 1, 2, 2, 3, and then we combine the numbers. But either way, what range of the scale are you in your capability of eliminating mercury? So if you're a woman who is of childbearing years and you want to have the healthiest baby possible, there are certain things you're going to do during your pregnancy in order to protect that baby. And one of which is avoid all toxic materials, obviously. But what if you have 10 mercury fillings in your mouth and never knew that that mercury actually comes out and leaches out and can enter into the developing fetus or be part of your nursing after the baby is born? But that mercury at least has a charge to it. So methyl mercury has a nice carbon group on it, and that way it's not passing through the blood-brain barrier, and it's not passing through the placental barrier. There's only one form of mercury that can do it, and that's ethyl mercury. And that's for many of the other speakers speaking here this weekend to address. I did have the opportunity to meet the producer and director of the movie Trace Amounts, which is a movie about how the protagonist was poisoned at work, and also poisoned through heavy metals in his medicines once he got tetanus. And so I've had a number of different patients with a number of different types of mercury exposures from the industry, from different healthcare products. Most people aren't using creams with mercury in them, but we're trying to get rid of those. And you get this soup. So of this soup of toxic materials, what can you control? What do you have the freedom, this health freedom that we discuss and cherish so much to change and make yourself healthier? And so, you know, depending on what's coming up with the elections and which healthcare plans are going to be new or stay in place, and which recommendations can be made for this is a form of healthcare that can be more toxic than this form of healthcare, and which one is going to get paid for. These are all things to still be debated and decided. These have not been set in stone. What I will tell you is that it is so wonderful after all these years of working on this subject and all the people and interactions that we've had with all these lectures and thousands of hours of people working on trying to educate the public about what a mercury filling is and how to cope with the use of it, and how to, whether it's on somebody else or it's already been used on yourself. And what pace should you go at to have them removed if, according to the FDA, you should have them removed at all, because the exposure to mercury should approach zero during the removal process. It never really can be zero. I am extremely careful with trying not to touch the mercury filling ever while removing it. And typically, I'm able to use a very tiny material and go around the filling, because if you were to drill on just the mercury and remove just the filling that way, creating so much debris, it's like a volcanic eruption. We had the particulate study was published showing how that's like an atomic dust cloud for the office when you touch a mercury filling with a drill. Whether you have the water on or anything, and the suction, you still just explodes it out in a giant dust cloud. Almost like when somebody sneezes and you spread all the droplets out. That's almost like a similar type of comparison. So how do you minimize to yourself and find a dentist and discuss with them before beginning treatment? Hey, did you know that the mercury manufacturers require that you use a dental dam for the removal of my mercury filling? That alone right there will protect a lot of people from a lot of debris. But it can't be a perfect procedure, because invariably you're bound to nick or touch some of the mercury along the way. And you can usually tell because you'll see a little bit in these special suction tips that I use. You can actually see if any gray goes in there. And that means that I've touched the mercury filling with the drill. And although not by intent, sometimes fillings aren't perfectly in the tooth, and they can have little extensions or parts going out, or the previous dentist had drilled a little nudge into the tooth so that the filling was kind of hooked in and it had this little arm coming out of it. So you're attempting to approach 100% not touching the mercury filling. And if you can be at 95 to 99%, is that good enough? And this is what the dentists of America and the rest of the world have to step up to. And as the patient, you need to be demanding of that dentist to be very concerned. And it is possible that if you appeal to their sense of well-being, their sense of community, their sense of religion, their sense of commitment to their own profession, their morals, and so forth. You can get these dentists to perform dentistry at a higher quality and a safer rate for yourself, for their staff, and the environment. You know, it's amazing. They used to have these, when I was in dental school, they would always say that dental assistants would get a number of, had a very high miscarriage rate. And no study has really been done except for in Europe, in Denmark and Sweden, where they looked at the assistants to show this. But they used to tell me that it was the nitrous oxide that was causing the miscarriages for the dental assistants. And I've always wanted there to be a study showing, especially amongst patients, you know, was there a higher incidence of these events during the placement or removal of a mercury filling in a conventional way, which was just to drill on the metal, not have a dental dam on, and expose this patient to the heavy metal toxicity. And so, you know, that is a retroactive study that can be done, and it's likely to show that, you know what, there is a strong correlation between the amalgam fillings and something like that. Now, of course, that would create a liability issue that would be out the door in a heartbeat for all the attorneys in the world, and but maybe rightly so. And that's something where every night when I go to bed, sometimes I have to ask, hey, just saying a prayer here for everybody in the world to be healthy and safe and sound and get to wake up tomorrow morning and have a chance to be healthy, safe, and sound. And they have this freedom that we show cherish, something that everybody in the country seems to be fighting for now. Regardless of which side you're on, everybody thinks that the other side is trying to steal their country. And in the meantime, I have tried to work with 4 administrations to move this ball forward, working with the different toxicology academies, the different holistic academies, working with Charlie Brown and Consumers for Dental Choice and his DAMS, which is Leo Cashman out of Minnesota, who's a wonderful man the DAMS organization has helped so many people with advice. He's gotten on the phone and tried to direct people to get their best treatments possible. And then it becomes more complicated because now you have things like osteonecrosis, such as the cavitations that people speak about when you've had a tooth pulled out and there's still remnants and debris that have remained behind that have now grown into little colonies living in your bone. And I will say it is shocking once in a while when you have a patient who needs just a simple wisdom tooth taken out, a straightforward procedure, and the tooth is a little loose. It shouldn't be a big deal. And you take it out and there's black mold on the tip of the root. And the patient was moving around from apartment to apartment, always complaining that they can smell the mold and there's mold in this apartment. And every time they were being tested, they couldn't find any, but the patient had to move again. And really, it was on a tooth. And so these are new things we're discovering that should be well known already, should be taught in school. There shouldn't be a resistance. There doesn't have to be a resistance to this new knowledge. That's the point. That's why most of you are listening to this, is there should already just be an education process for, let's say, children in school. If the whole month of February is National Dental Health Month. You know, besides teaching history during that month and the point of view of indigenous peoples versus the conquerors, there has to be a balance between how much toxicity a person can handle and, as practitioners, why are we even doing this procedure in the first place? And to be taught a procedure, you know, like for example, I had to finish a certain number of mercury fillings and a certain number of tooth colored fillings 30 years ago when I was in dental school. And for my board exams, I actually requested that I could do a composite filling instead of an amalgam filling. And they said no. And so I had to place my last mercury filling that I ever placed in my life was for my board exams in 1993. And I've placed almost 100,000 restorations. Every single one of them have been in porcelains or composites. And you know, it is a challenging job. And it is hard to keep an area dry in the back, which is one of the arguments for the mercury fillings. If you have a gum line filling on the side of the tooth all the way in the back, and this person is hard to keep dry, and it's difficult to get a dental dam back there because you have to go under the gum tissue, and there's a number of complications. This is the argument to still use amalgam filling, just because it's hard to use the other filling, a tooth colored filling or a composite filling. And as someone who's used them in every situation possible, I have to agree, there are situations I did not get the optimal result in. So you don't have the perfect materials. And doing a simple chewing surface filling, like I was able to with my twins over here, there were 7 chewing surface amalgams that were easy to take care of, each one with an individual dental dam application. Didn't even have to do them in a group because they weren't next to each other, and had to do them all as an individual filling. And those were, as far as the dental portion and the procedures, really easy to do. Able to get them to come out. They weren't very deep fillings. As I went around the periphery, they kind of flew out of there into my special suction. By the way, there are special suction tips, the vacuum tips that have a mercury filter built into them. It's one of the things I showed at the United Nations. And these tips are great. You can capture all the material and then place it into your box that you store outside your office, and then ship that back for recycling once you've gone through all the tips. If you don't have one of those, another thing that could be done is you could put gauze on the end of your suction to try to capture and keep as much stuff out of your system as possible if you're a practicing dentist. But then you have this gauze that's contaminated, which then you have to place into a mercury recycling container, which you should keep outside your office. Now, some of my colleagues have taken a much greater step. Again, I was very fortunate to have my mentors be Dr. David Kennedy, Dr. Boyd Haley, and my most significant mentor, Dr. Hal Huggins. And so lucky to have him in my life for as long as I did. And I first heard of Dr. Huggins when I was a freshman in dental school. I paid my $25 to join the American Dental Association. And, you know, what did I know back then? I was 20, 21, 22 years old. And the first ADA newsletter that came out, you know, talked about this dentist from Colorado, and they had to take away his license because he was falsely claiming that mercury fillings, that mercury leaches out of the filling, and that the materials can be toxic to you, can bioaccumulate. And that was, I believe, in 89. And so you've got 30 years on down, 40 years, 30 years on down the road, and the ball's been moved forward through 4 presidential administrations, ranging from one end to, it's come pretty far. And you know, depending on who wins the next election, either the current administration can continue on their path of helping patients get health freedom, which would probably help win the election if the healthcare plan would be as such, you know, or if the other side wins, then you know, Joe Biden was hopefully part of the making the UN process, and the ball could be moved forward at that point. But you know, they didn't move the ball forward at the FDA because all the hearings and the presentations that we gave back during the last administration kind of fell on deaf ears. So what an opportunity we have at this moment to keep this going, to keep this ball moving forward, to have patients such as my twins or patients out there that would have to file a complaint with the FDA for the FDA to begin recognizing that people are having mercury health problems related directly to their mercury fillings. And again, a very difficult thing to prove, but there are studies that already exist. There's the famous studies from that are actually held at the Academy of Toxicology for our monkey studies, and showing how the mercury, when placed into the fillings, immediately goes into the digestive system, and then you can see it in the kidneys, and then you can see it in the entire nervous system, where mercury loves to bioaccumulate. So, given all this information, yes, tremendous strides have been made. The recognition that women and children must be protected, but that for some reason, men aren't quite in the group unless you have a neurological issue or Parkinson's disease, or you have a kidney failure and you can't process the mercury. So the group has grown, which is basically just a repeat of what the European Union has done, and moving the ball forward on that. And it's actually, like I said, these UN meetings, this virtual meeting isn't the same as being in the room full of 1,000 people and commiserating like we used to in the old days. And maybe in a couple of years, we're going to get back to that. The COVID response, like I say, is just a pandemic response, which is standard response in the Homeland Security Manual from almost 20 years ago that I received when I volunteered in 2002. This is one of the first groups of volunteers for that. And so doing an all the above approach works with anything. It's almost like how we recovered the economy. It's how we have to raise our children. We're trying to give them everything we can to be as healthy as possible and not be sick. Now, unfortunately, because of a number of other conferences that I attend, I speak with a number of people who have been victims of their health care or had predispositions that were not recognized. And the use of this particular drug or this particular type of treatment exacerbated tremendous and horrific side effects, which I guess if you just put it on the label, because I've been watching TV commercials, and it's not a political commercial, it's a commercial for certain medications, which show people playing in a park with their dog and how wonderful life is, but 80% of the verbiage in the commercial is all the side effects and the negative things, some of which include death. And but otherwise it works. So now we have to weigh our risk and our reward, our benefits, our pros and cons, and is it worth the treatment? So for example, I've got a pinched nerve in my neck. Should I have the surgery that the surgeon is recommending, or should I wait and try to do everything in my power possible to avoid surgery, which is basically a result of stenosis, which is very difficult to reverse. But I'm throwing at the kitchen sink at it because I'm going to try. So if you already have mercury fillings in your mouth, it's hard to determine exactly how much illness can be created by just your amalgam filling and how much of your condition that you can change based upon the safest removal of that mercury filling. Because you still have the mercury inside your neurological system, it's in your tissues and all your adipose tissues, and now you have to get that out. You have to chelate that out. And so some of the ways you can do that to get the different types of mercury out, most, if you do an IV chelation and so forth, tend to just get the mercury that's floating freely in your bloodstream out. It's not going into your brain and removing the mercury that has found its way, let's say, into your mitochondrial processes inside the cell, so that certain types of mercury have been able to cross the blood-brain barrier, cross the cellular barrier, cross the mitochondrial barrier, and then once in the mitochondria, change their formulation, lose a carbon group, and now become a disruptor of all your mitochondrial processes. So for example, the production of glutathione is the easiest one, because glutathione is typically what's eliminating your mercury out of your body. And of course, mercury is wonderful once in the mitochondria of stopping glutathione production. So it also takes the place of magnesium, and it will precipitate with other elements such as aluminum, which all exist. In fact, being the most abundant source on Earth, we all have aluminum in our bodies. In fact, the other day I was making sure that my deodorant didn't have aluminum in it as usual for a number of years. And even that's not enough because there's still other chemicals that are in those deodorants. Might as well just use the rock or something that can go under there. So do you have the freedom that you want and possess for your choosing all of your own health care? We're striving to create that. We're here in a constructive way to try to do that. I have found that getting the people who legislate to understand the depth of a problem and coordinate with industry as well, because they have their concerns, which aren't always lined up with the patients, as most of us know about that. And I'm trying to be as cordial here as I possibly can. But which administration is most workable to help with this problem? Which administration in the future is going to recognize that, oh my gosh, you know, we have a problem here and we need to address it, and here's the best way to do it. I would love to be part of that solution. I hopefully have been pushing the ball forward at the United Nations. I was able to get a technical assistance program. I was very fortunate to work with David Ward, who is up in Canada. He has a fantastic practice where he has a positive pressure room and wears the entire spacesuit, and is one of the most conscientious dentists on the entire planet on removing mercury safely and protecting his patients from the exposure as well as the environment and so forth. And then, of course, on the other end of the spectrum, I have the dentist who just put in 3 mercury fillings into a teenager who has now experienced some side effects, and also put a stainless steel crown on the tooth next to it. So now I've got dissimilar metals right next to each other and chewing on each other as well. So that is something that could have been avoided, something that maybe a large composite could have been done on the molar instead of a stainless steel crown. I know it's the standard of the industry, but stainless steel is nickel and chrome. So, you know, is the stainless steel breaking down in the mouth? Maybe not by itself, but what in the presence of other metals? What if a different acidity is present? What if the patient isn't at 7.4, but is at 6.8 in a pH? And so you find that in a lot of patients with chronic illness. And this isn't even including anything to do with the immune system yet. And for a number of you out there that have immune system issues and complications, maybe things where it's a vague diagnosis, such as lupus, where we're not sure why your immune system is dysfunctioning the way it is, but it is. Different leukemias, you know, why is the immune system over or underproducing its white blood cells? What type of chronic infection is latent somewhere, some type of virus or bacteria? Is it anaerobic? Is it a spirochete or a swimmer? Or, you know, what do we have that we're dealing with? And of course, what I've learned over the years is that we're all full of everything. We all have bacteria, virus, fungus, mold, and parasites in us. There is just a differentiation on how much of each type and what is our balance. For those of us who feel fairly healthy, why are you not sick from the different parasites that live in you when the full moon comes out and they tend to hatch and replicate? Why aren't the spirochetes burrowing deeper in or swimming more in your body? You know, we've disinfected the mouth. You can't sterilize the mouth. That would be a little too much. You don't want to kill all the bacteria in your mouth because they're beneficial bacteria. People who are using alcohol mouthwashes or a lot of peroxide, I mean, that's you're kind of carpet bombing your bacterial flora in your mouth. And then, of course, all the dead ones aren't letting those nasty products get deeper down into the depth of your gum pockets to kill deep within. You kind of need a forced irrigation down there. Again, another trick learned from David Kennedy, how he rinses out with his disinfectants. So getting back to the mentors, of course, is Hal Huggins And fortunately, a wonderful dentist took over for his practice, Dr. Blanche Gruby, who I know is a very active member in the Health Freedom Expo, and should be speaking this weekend as well for you. And just, she is so educated and knowledgeable. And so now we come down to all these different patients and everybody at different levels of problems, and who needs the entire gambit of the most amazing treatment of everything that could possibly be done to get mercury out of your body, where some people just need it removed safely and just need some simple support protocols, and other people, oddly enough, report that they feel fine and have no discernible issues and can't seem to generate any problems associated with their mercury fillings, which means, according to the FDA, those should be left alone completely. And if you were to remove them because of potential effects, I just simply need to explain to all the patients, and every dentist would have to do the same thing, is that you have the advantages and disadvantages, the pros and cons, the informed consent. And so once you have full informed information, and then you can have that consent based upon the risks and the benefits of the procedures. So I feel good that the FDA has ruled in a positive way. I don't think they've done everything that can be done, and they're proceeding with caution because there isn't enough evidence and proof of everything that most of the holistic dental associations have put forth as their research and so forth. And I recall an event when I was at the United Nations. It was a long lunch line, and I happened to step in right behind the head of the scientific union, the European Union's scientific report publisher. And I happened to have the rebuttal report to the ADA publication at the time. This is 2014. And Dr. Joaquin Mutter had written a 293 corrections to the American Dental Association report. And I felt that given the opportunity to stand for 10 minutes next to the head of the department, who was going to publish basically a copy of the ADA report and just regurgitate it, why not give them the opportunity to understand the depth of which what they're trying to publish isn't exactly going to square up with scientists. So during this Health Freedom Expo, I wish everybody has a wonderful learning experience. You are able to apply what you've heard here and pursue your health with as much freedom and choice as possible. And to all, I bid a beautiful weekend, happiness to your soul. May we all be healthy in this COVID crisis, and we're all going to make it through this if we stick together, follow our protocols, and be happy, healthy, and wise. Thank you, everybody, for listening. Thank you, Hal Huggins, for taking on the legacy, as I could say, of Weston Price. And this is the reason why I do this, because everyone deserves to know what is going on in their body, and now you know more. Thank you. I'm Dr. Dave Simone. I appreciate you listening to me. Have a wonderful weekend.